Hi, I'm Andrea Silva and I'm gonna explain the post-operative assessment and procedures. Um, Mostly and most importantly, in a collaborative practice, it is important to hand over the report and review operation room record and anesthetic record. And it consists of the IV fluids, blood products that is transfused during the operations, medication administered to the patient, blood loss, a complication that happened to the patient during the surgery, and the procedure completed to the patient. After that, it is important to review post-op medical orders by the physician in order to know what to do to the patient right after the surgery, and if there's an important thing to do regarding the patient. Once transferred to the bed, immediately attach the equipment like the catheter, the tubings, the patient. And right after that, you should conduct a complete post operative assessment and measure all the vital in an early hi in early post-operative period. You should always monitor closely the post-operative vital signs. So in the first hour, you should check the patient every 15 minutes in 1 hour, and right after that you should check the patient 30 minutes every 30 minutes in 1 hour, and after that you should check the patients every hour for 4 hours, and then check the patients every 4 hours after that. And if there is any abnormal findings in the vital signs, you should report it immediately. The the three most important things to be checked to the patient for the initial postoperative care is the airway, the level of consciousness, and the surgical incision. Remember that patients that went to the surgery is in a risk for hemorrhage. That's why it's very important to check the surgical incision of the patient. There are also post-operative complications that might happen to the patient if not monitored closely, or if he or she have an underlying conditions that might affect the post-op surgery condition. And one of the early complications that might happen to the patient are hemorrhage, hypoxia, embolism, hypothermia, fluid and electrolyte imbalance, and urinary retention. And the later complication might be evisceration, dehiscence, wound infection, UTI, and pain. Take note that the evisceration is a medical emergency. Wound dehiscence and evisceration occurs mostly after coughing, sneezing, or getting up from a sitting position. It's always important to remind the patient to be always careful and use pillow to splint the incision.